Welcome to the latest installment of New to the Street. I'm Janet Alvarez here from the iconic Nasdaq marketplace. Joining us today is an iconic company, Health and Tech, and their leaders are here to talk about some impressive results they've been posting recently. We're joined today by Tim Johnson, CEO of Health and Tech, and Julia Qian, CFO. Tim, Julia, welcome to New to the Street.
Thank you.
Thank you. So Tim, you have posted an impressive rise in partnerships. Those partnerships crucial to Health and Tech's growth. Tell us about that growth in partnerships and what it means for your company's trajectory.
Sure. Thank you. We have been out marketing our business now for 2 or 3 years since its initial startup. At this point, our technology is really catching on, and we're catching the attention of some of the larger broker houses, some TPAs, some people that are looking at us that probably wouldn't have looked at us before. Obviously, now since we're listed on Nasdaq, we're catching all that attention. We're getting larger brokers with hundreds of agencies, hundreds of offices. It's getting a lot of attention, and we're growing pretty quick that way.
So Julia, your cash position is enviable. You ended the quarter with over $8 million in cash. Tell us about the cash position, how you have established yourself in that manner, and what you intend on doing with that stockpile.
As an Insurtech company, we are very disciplined of our expenses management, also balance the investment and the tech build and versus how we spend and generate the revenue. So our accounts receivable day has been way below 30 days. So we very focused on that as well. Plus, we are a profitable company. Since the inception of the company has been profitable, we keep growth momentum. And to us, it's important we have sufficient runway for us to build all the tech we need and continue to grow the momentum.
Julia, and speaking of that momentum, your second quarter results were absolutely enviable. You beat on the top and bottom line. Tell us about those second quarter results and what most impresses you about them.
Yes, our revenue grew 86% year over year, is 9.3 million. So for the first half of the year, we did 17.3. Just give some idea, entire year last year is 19.4 million. We did 89% of the entire total last year. And then we're looking at, in terms of profitability, we continuously to be profitable. You know, our EBITDA, it's very impressive, and we grow more than 200% of the last year being profitable. So all these just to tell everybody, we are disciplined, but also our product resonate in the market. Our technology really get traction. That's how we see the top line and the bottom line growth both ways.
That's wonderful. And Tim, you've been working on modernizing and improving the underwriting platform for Health and Tech. Tell us about that underwriting platform and some of the big changes we're seeing there.
Sure. We started out focusing on small group. They were the most in need for help, how we did the whole process. So now that we have that pretty much running really smoothly, the process, our systems run great with small groups. We're being asked by our brokerage side, our houses, that help us with our large group. If you can do this on small group, which is very difficult, clearly you ought to be able to do something for us on large group. So we've been working on this, our large group system, for 6-8 months now. We think we're just about have it perfect so we can roll it out here in the third quarter. It's really going to change the way people provide us submissions to underwriters, how they communicate, how fast they can get their job done. It's going to be very neat.
Julia, managing your cost structure has been vital to Health and Tech success. Tell us about that cost management. What underpins it?
Yes, so that's a great question. We have 3 categories, and one is sales and marketing. And we look at not only just absolute dollar spend, but also we measure as a percentage of revenue. So when we're looking at that, those partnerships, the teams bringing, the business side bringing, and we really don't need to grow that much of the sales marketing because we leverage these partners. So think about those partners, they gave the distribution to the brokers. It's all free to use, and then we don't need to build amount of sales as same as increased the revenue. So we measure that, we maintain that very good discipline. and the two categories. Second category is our technology spend. So a lot of technology spend going to the software development, which is building our software assets. And we manage that very closely. We constantly balance what we're going to spend in terms of whether it's AI, whether it's the large group underwriting, other features. We prioritize and make sure they can generate revenue. We'll be mindful. And third category is really the administration type of cost, and being listing in the Nasdaq give us the visibility, but also that's the cost doing the business. It's about almost 7 to 9% of the revenue goes to being a public company. We have to burn those costs, but we're very conscious the top line revenue comes in will much more reward us to continue to be mindful. So yes, with good discipline, with internal control process, constantly monthly measurement, every executives have the KPI of the expenses we have to meet, and every month, every Friday, we have executive meeting. We go through all these things along with the business. So I'm very comfortable and thrilled to be part of the team to make that happen.
Congratulations. So many exciting things happening in health and tech. And you guys are actually going to be hosting a summit at Davos at WF Week. I'm jealous. Throw me an invitation.
Yeah, we'll do it. So Davos is, Julie and I have both been. She went 2 years ago, I went last year. We both found that the people that we get to meet are very, they're the smartest of the smart, right? They're the best out there. And when you walk off stage and they come up to you and say, hey, I want to figure out how do we work with you? We're trying to figure this out. And they're from all over the world. They're trying to figure out, how are we doing this? What do we want to do? How do we partner with you? We want to do that. But we also, this year, we're hosting a bigger event. And we're inviting a lot of the hospital executives, our top brokers, people from the investment company that we're working with, people who are looking at us. We want them to participate because, that interest level by them talking at these panels that we're going to have and participating with us, we want full transparency. We want everybody to have a little bit of touch, a little bit of piece of the company. And then we think we can do that there.
That's wonderful. And what excites you most about the future of health and tech?
The new products that we're planning on. We have a 5-year plan, and the rolling out of these products are going to change the way people think about how they buy it, health insurance, where they get it from. That entire process is going to change.
We will be absolutely paying attention, excited to see the future of health and tech. Julia, Tim, thank you so much for joining us today.
Thank you.
Thank you for having us.
And thank you for tuning in to New to the Street, where we bring you wonderful stories about the future of innovation, healthcare, and technology in America. Until we meet again, I'm Janet Alvarez from the Nasdaq.